Hello and welcome to the Carifree 10-minute overview. This video is designed to give you a quick look at the Carifree Ctx program and just help you envision how it might look in your office. Carifree has worked with thousands of dental offices and dozens of dental schools over the years implementing CAMBRA systems. CAMBRA, of course, just stands for Carrie's Management by Risk Assessment. Now, this medical management style of managing dental decay has become very popular, but it's often tricky to implement. Now, the reason for this struggle was actually pretty simple. Everyone's a little bit different. And just like treating patients, there was no one-size-fits-all approach to implementing these programs. So the CTX program was designed to be a little bit different, to be a little bit more nimble. We want to allow offices just to make a few choices to determine how this program is going to be the best fit for them. The first question you have to answer is actually pretty simple. Who do you want to treat? Some offices like to take a very systematic approach to CAMBRA. They want to do risk assessment on every patient, every time somebody walks in the door, we're going to go through this. And while that certainly does yield the best results in terms of data and outcome, it's not always the most sustainable. It's not always the best fit. Some folks just want to have another option for those folks they know are having a little bit harder time. The folks who every time they come in, there's problems around margins, a new white spot lesion, some new issue that they have to address, and they just want to have something in their back pocket for those people. Well, that's okay too, because the CTX program allows you to make those choices. And even though you might start off one way, we have ways where you can actually alter your course along the way so we can make sure the program evolves over time into the right fit for you. Now, if you have chosen to take the systematic approach, the very first step, of course, is going to be to gather some information. When the patient checks in, they're actually handed what's called a risk assessment form, and this is where the whole process starts. The top half of the form is designed to be filled out by the patient as they're waiting. The questions aren't anything terribly invasive, most of it's just related to behavior. Once the patient's been called back into the operatory, the team member will then fill out the rest of the form. The remaining questions are a little bit more clinical. We want to assess the patient for new progressing white spot lesions. Is the past history of decay a concern? Do they have appliances present, deep pits and fissures, questions like that. This is also the point in time we will run the Carrie screen exam. For those of you unfamiliar, the Carrie screen exam is actually a 15-second chairside test that we use to determine what's going on with the bacteria in the patient's mouth. Now, let me just say right away, not every office needs a meter. These meters really only work best when you're taking the systematic approach, meaning you're screening every patient every time. We've seen in the past when folks are hand-selecting patients to swab, sometimes their data sets just look like a shotgun blast and it's hard to really find any good trackable data. So again, if you're thinking about hand-selecting patients, you just might not need this. But for those of you who are looking to screen your patients, let's take a little bit closer look on how you actually perform the test. It's very simple. What we're doing is we're using a pre-impregnated cotton swab to take a bacterial sample off the lower anteriors. Just basically 22 through 27, canine to canine. We want to make sure we get one firm swipe to gather our sample. From here, the swab just goes back inside the tube. We bend a top bulb, releasing a few reagents against the swab, spend a few seconds mixing up our sample. The whole thing then slides on top of the unit. We shut the cap, you hit one button, it actively counts down from 15 seconds, and you get your answer. So let's talk a little bit about what you're actually looking at. We get questions all the time about, what bacteria are we looking for? What does that number actually mean? And what we're actually searching for in the biofilm is what's called ATP, or adenosine triphosphate. Many of you might recognize that as an energy molecule. And here's how that works for us. We know that the healthiest mouth of all is still going to have billions, if not trillions, of bacteria in it. And for the most part, we're not concerned with overall bacterial load, because it's not about quantity, it's about quality. So the reason that we picked ATP is because bacteria that generate higher levels of acid tend to generate a lot more ATP. On average, it's about 100-fold. So once we knew what to look for, they stuck out like a sore thumb. So again, high levels of ATP correlate to high levels of cariogenic or acetogenic bacteria. One thing to keep in mind is that this is not a measurement of existing decay. It is looking at risk. You almost want to think about this like cholesterol, where if somebody came in and had a cholesterol test and it came out very high, it doesn't necessarily mean that they're currently having a heart attack or that a heart attack is imminent. It simply means that they're of higher risk. And naturally, we would want to start taking steps to decrease that risk. Now, the number we're looking for on the meter is a reading of 1500 or less. 1500 or less is low risk. That's a healthy biofilm, that's what we want. Anything above 1500, and we would consider the patient at risk. And naturally, the higher the number, the higher the risk. Now, after the test score has been recorded, we can complete the form. Once the form's finished, you can see here along the bottom, we are able to place the patient in the appropriate risk category, from 1 being low risk, all the way to 5 being extreme risk. So now that we know the patient's risk level, the task is obvious. We want to decrease their risk, and we do so by using a few targeted therapies. I'd like to introduce you to the CTX guide. Basically what this is a quick way to figure out exactly what we're going to utilize to help fix the patient's problems. The elements are pH neutralization, the usage of an antibacterial, fluoride, xylitol, and a new nanocrystal of hydroxyapatite that we're using to support remineralization. This video is not going to get in depth on any one of these elements specifically, but I'll show you how we can use the guide. On each and every treatment item, you'll recognize that CTX guide. So here you can see on our CTX4 treatment rinse, I can easily recognize that we're using a high pH, an antibacterial, fluoride, as well as xylitol. So we have 4 strategies being employed, so it's a CTX4. This convention, of course, is going to hold true for all the products, including our CTX3 rinse and our CTX4 Gel 5000. So let's put it all together. Once we know what the patient's risk level is, all the team member is going to do is reference what's called the treatment guide. From here, you simply find the column that matches the patient's risk level, and we give the patient 2 therapy options. The top tier option is what's called the recommended therapy. This would obviously be our first choice for the patient. However, if that's too aggressive, especially for patients who aren't familiar with this program, we also have what's called a provisional therapy, which is a little less time and generally less expensive. Certainly not designed to fix all the patient's problems, but give them an experience with the treatments and make sure it's going to be a fit for their household. Now, naturally, the patient still has the opportunity to decline a treatment altogether, and that's fine. But one of the things we did do at the bottom of the form is include the statistical likelihood of new decay within a year should the patient go untreated. So you'll notice for our high-risk patients, there's actually a 70% chance they'll have a brand new lesion within a year. For your extreme risk patients, it actually goes up to 88% chance. So there's an 88% chance that when they come back in a year, they might be having problems around margins, or new interproximal decay, or progressing white spot lesion, or some sort of issue that needs to be addressed. And if that happens, it's fine. Timing is everything. So when the patient comes back, and if they had declined, that's fine. Because rule number 1, we're always going to take great care of our patients. But as long as this is their risk level, this is generally the pattern that they can expect. And when the time is right, we have some very successful strategies that work very well on decreasing their risk. Now, as you examine the treatment guide a little bit more closely, you'll see that the choices come in the form of a number. You'll see things like CTX26 kit, CTX36 kit, CTX21 kit. Let's spend a little bit of time on what that number means and how you can explain it to the patient. That number is simply an expression of how many elements are being utilized and for how much time. So as you can see here, with our CTX36 kit, the patient has 3 CTX4 gels and 6 CTX4 rinses. 12 plus 24 equals 36. CTX36. Now that might seem a little complex, but believe me, it's actually simpler than it seems. And there's nothing to actually memorize. On the side of every kit, of course, are the instructions and a detailed breakdown of what's inside. If the patient feels overwhelmed, you can always just remind them it's just a different toothpaste and a different rinse. Just brush and rinse in the morning and brush and rinse at night. Come back and get rechecked. Now, we certainly don't have a crystal ball. I certainly can't tell every office exactly how it's going to go for them, But we've been tracking a lot of data since we made these choices. And so far what we found is roughly 80% of people will say yes to a free screening. What you can see here is kind of how people tend to fall in that risk continuum. But more interestingly is the case acceptance. So far, when people take the systematic approach, we've been seeing over a 50% case acceptance, which of course is wonderful. Now that being said, will that be true for you? We've got no idea. So we always encourage you to go through your training, get trained, and based on your experiences, don't be afraid to change course. We have a lot of offices that started off one way and wound up being completely the opposite after they had a few months under their belt. And that's perfectly okay. So if you are exploring the system, that first question I really encourage you to explore is, how do we want to do this? Do we want to do this for every patient, every time? Or do we just want to hand select those folks that are having a bit more trouble? Once you have that question answered, give us a call. We're happy to schedule a 20-30 minute webinar with you and just have a quick consultation. We'll ask you a few questions, try to figure out what's the best fit for you, and we'll go from there. Thank you so much.